Thank you so much, sir, for that wonderful opening remark. We are moving to the main agenda of today, which is the lecture. We have in our midst now the principal, School of Peri-Operative Nursing, Ahmadu Bello University Teaching Hospital. A round of applause from you. Welcome, sir. Thank you so much. Despite your tight schedule, it's not easy. Anytime any school is conducting exam and you still have time, Professor Hassan, you are highly welcome, sir.
Words carry the weight.
That as one of the aims for us to be able to achieve best practices health information is universal electronic medical records in the future. Now the other diagram here is to show you that health information is a very broad field per se because it involves many things. There is computer science, there is data science, there is administration, there is management, and there is some basic information about patient care itself. That is why people have to learn anatomy and physiology. And it also aligns with the broader field that is called health informatics. Now, I looked at the history of health information management, and it started up in the 1920s, precisely in 1928, when the American College of Surgeons called for the standardization of clinical records in the US. They had wanted to do a research to find out how many surgeons did what type of surgery and what have you in the 20s. And it was not standardized. The way health records were done in one hospital differs from another hospital, differs from one state from another. You know, in the US they have states that are semi-autonomous. So every state had its own. And they realized that there were some haphazard things. And from that meeting, that was when the American Association of Record Librarians was established, and which transformed to present-day American Health Information Management Association, AHIMA. In the 1960s, which was known as the Information Age, there was increase in volume of patient information because physicians were now asking more questions and documenting more things about patients. And there was improvement in data collection. At that time, computers came into play. Unfortunately, computers were too expensive to be put in hospitals at that time. A few hospitals may have them, but they were too expensive to be put for universal use. So at that time, some electronic health records software were designed by some universities, but they were not universally acceptable. In the 1990s, significant boost in software development came into play. That is when computers started becoming a bit cheaper and affordable, and people now realize that, okay, there is a room for us to make some input into electronic medical records. And the first major one was the introduction of the computerized patient registration and master patient index in the US. But then newer software were being developed. Coming to the 2000s, when the era of evidence-based medicine came in place, let me digress a little. When we say evidence-based medicine, in the past it's very easy. If we have Professor ABC in surgery, who has experience in doing appendectomy, then whatever you want to do, you just go and ask him, Oga, how do we do this? This is it. Evidence-based medicine says no, you cannot rely on one person's experience. You must get evidence from across different places to be able to conduct research that you can analyze and say, okay, this is the best approach. So at that time, we realized that we do not rely on the experience of one person or one center. You have to have the experience of people across the globe. That is when the era of multinational researches came into play. Okay, in ZARIA, we give patients with hypertensive diuretics. In Zambia, we don't. In Cameroon, we do. Here, we combine the two. Then you do a research to find out which is the best evidence for you to use. Now, the good thing with the 2000 was that the president of the United States at that point, President George Bush, signed in 2004 for the United States to adopt universal electronic health record. So the computer changed this, is EHR, is using it as HER. I don't know what happened. So anywhere you see EHR, yes. So it was signed as a law in the United States. And the Office of the National Coordinator for Health Information Technology was created in the United States in 2004. That was the turning point in electronic health records. So in Nigeria, yes, I got this book courtesy of Mr. Saka of the School of Health Information Management. Health records were as old as medical practice in Nigeria. The first documented Orthodox hospital in Nigeria was the Sacred Heart Hospital at Abeokuta that was opened in 1875. And by that time, they also had electronic medical records, but they were kept by nurses. There was nobody who was designed as record officer. But by 1948, when the University of Ibadan was established, and they wanted to establish the University College Hospital for the training of medical doctors in 1955, some few Nigerians were selected by the then regional government and were sent to England to train as health record officers. The records department was then created as UCH, and from then on, medical record, then it transformed to health information and statistics, then is now coming to, what are we now? Now, for Ahmadu Bello University ZARIA, medical records department was started in 1968 by one Mr. A.O. Fakonle in 1968. I hope students are following this history. These ones are your great-grandfathers. Since Oga is your grandfather. Yes. Now, and since then, Abbott School of Health Information was the second school of medical records in Nigeria. After that, that was established in University of Ibadan. And by 1989, the Health Record Officers Registration Board of Nigeria was established by Decree 39. And our school here, like we said, it started as School of Medical Record initially. Then it changed to School of Health Record and Biostatistics. And finally, it became School of Health Information Management. And now we have accreditation by both MBTE and Health Record Officers Registration Board of Nigeria. I hope students will have access to this book in the library. Okay, good. So, what is the role of health information management in the 21st century? Like we said, while the image of a doctor, surgeon, nurse, or pharmacist might be the first thing that comes to mind when you think about healthcare industry, a lot of work is going on behind the scene. A lot, isn't it? A lot of work is going behind the scene. In the 21st century, health information and data is asserting itself as the equally important counterpart to more physical aspects of medicine. Still a developing field, but people interested in health and wellness should know it has already had a significant impact on the healthcare industry, and is only gaining momentum as its full usefulness becomes clear. As you can see in this picture, it is an intentional picture. This is a doctor, this is his nurse. They have done their work and finished, but he has come to consult the health information manager to get data about his past patients. I hope you can see. That is the role in the 21st century. It is not staying in the health information record library alone. No, you have to come out of those offices when the need arises, because you will be part of research teams that will be meant for improvement of healthcare in the future. Now, if you remember, in 2014, the President, Muhammadu Buhari, signed the National Health Act in 2014. And if you look at Article 35, it talked about the establishment of health information management for the country. And in fact, if you go to the end, it says, including private practice. This is very important. It's not only government hospitals. Even private practice must have health information management. And at the end it says, any private health care provider that does not provide health information management is liable to a fine of 50,000 naira or imprisonment or both. So now you can see the health information management has been enacted into the National Health Bill 2014. It is not just about if I like, I do it, if I don't like, I don't do it. No, it is now compulsory, because the National Health Management Information System, which we will see, is what is the basis for the planning of healthcare provision for the country. This is the National Health Policy of Nigeria, 2004. The whole of Chapter 6 is about National Health Management Information System, its establishment, its deployment, and how it is being used. We're still going back to our role, isn't it? We can see the major thing on the picture is what? Data. Data, every time data, yes. Data must be generated for health, but that data must be complete and accurate. Otherwise, it becomes useless. Or, worse still, it gives you the wrong interpretation of the data. Let me give you an example. Time go? Okay. If you take the wrong information about treatment of malaria in children, probably you did not document all the children, or you document only a few that came, and those people that came, they took the drug and vomited. When we do the analysis, we will say that all children that are admitted in ABU teaching hospital ZARIA between this time and this time, when they were given oral drugs, they vomited, and therefore it should not be given. That is a wrong interpretation of data, because it was not complete in the first instance. Are we sure? It is not accurate. So data must be generated, but it must be complete and accurate. That is why this kind of schools are opened, so that people will be trained properly on how to generate this data correctly and be able to store them with confidentiality. And these are people that should be trained as professionals, so that at any point in time, when I get to the cardiac clinic, I say, who is in charge of medical record? This is my name. Okay, this is my clearance that I want to do a research. Okay, how many cardiac patients did you see last month? He can just pick it and show me. This is it. Not that when you go, they say, you know, all these things these days, you know. No, that is not, he's not supposed to be there. So like we mentioned, health in the transformation, it has changed. Virtual teaching, for instance, even though people like me who work for us up till now are still skeptical about virtual teaching for core professional courses, but this is being applied in the US, in the UK, and other countries, and they are not having problems with it. Telemedicine, we have seen it, where a surgeon in England can perform surgery for somebody in Shika. He doesn't have to be there. They use robotics for surgery. There's online consultation, like we mentioned. It has happened during COVID-19. People stay at home and their doctor asks them to take their BP. They will show him on the on Zoom. He will not prescribe drugs for them because you can't travel. Things have changed and we need to change. In the olden days, the whole of this radiology department, what do? X-ray and ultrasound. What of now? MRI, CT scan. New things are coming every day, and therefore you must change what you do. Now the vision for the 21st century, like we said, is we have to invest more in health. This is not for me and you, probably the government should understand that. Health is an investment, it's not a waste. It is better for government to spend 2 billion naira buying medical equipment than give 2 billion naira to delegates. I hope we know that. Because the one you put in health is an investment. Where would that one go? Drain pipe. Now, patient-oriented care is the new norm. Patient-oriented care is not that me, I am the boss now. Every patient must come and do what I want in this clinic. Or patients have come to receive drugs in the pharmacy. This is our rule. Nobody can change it. We are the pharmacists here. No. The new norm is patient-oriented care. Because if patients don't come, you close down your facility. We have to also make sure our customers are satisfied. Isn't it? And we, the providers, must be friendly to our customers. That is why they said the health information management is like the welcome office for the hospital. If a person brings his sick wife to medical records and he has a very bad experience, that is the end. I hope you understand. Somebody comes to the medical record with his wife, she sits on the chair, he goes to Abunat, get out! That's the beginning of the problem. You are the real eyes of the hospital. You have to receive them well. Sir, you are welcome. Please have a seat. If you want to tell him, say, okay, sorry sir, you are not supposed to sit there. It is for the supervisor. Can you kindly move here? It is better than say, we have to be provider friendly. Otherwise, patients will not come. And unfortunately, the fact is that is why most people prefer to go to private hospital in ZARIA than go to Shika. I'm not talking about health information alone, no, it's everywhere. The attitude, people feel as if they are doing the patients a favor. It is wrong. But most importantly, 21st century is about universal electronic record. Have we started in ZARIA? Maybe later the coordinator will tell us. Why should somebody who has a card in Shika, then he lives in ZARIA city, his wife is sick in the evening, he comes here, he has to buy a new card? Does that make sense? Are there two different hospitals? That is what is happening. I have NHIS. I come here, I want to do something, they say you have to transfer from Shika to Tumwada. We have to look at patients. We have to look at patients going forward. This is the traditional role of health information. Look at it. How many of you have gone to that library in Shika? Huh? Yeah, 2 students go. Everybody has gone to that library in Shika. This is the traditional approach. Patient registration at first contact, discharge summary, records of death or discharges, analysis of visit, admission, birth, death, custody of certificates of birth and death, and other related things. In fact, I got a paper from, I don't know, what is his name here? Adebayo and Omole. Maybe some of you may know them. This is a paper they published in a very good international journal, and they stated some of those traditional roles here. I will share this slide with all of you at the end. So we've looked at the traditional role. What is the emerging role? That is where all these young people are expected to think. You should think beyond that library, the young men and women. Health information management now has to be part and parcel of health research. You are not supposed, the type of research you are supposed to do is not the same as the one that the surgeon does or the hematologist does, but you can work with them. For instance, we are not expecting you to come and say health information management, the number of appendix done in Abu theater. No. But you look at outcomes, isn't it? You look at the numbers, the outcomes, and what have you, so that you can use in healthcare planning. Currently, in the traditional role, basic analysis, that is what is done. Total number of admission for the month, total number of discharge. No, you are supposed to go into in-depth analysis about morbidity, mortality patterns that you provide for the hospital, the local government care officers, they call them, and then the state and the national. These are things that are supposed to be done from the national level, so that probably there is a system where ABUTH, AKTH will every month upload their data onto a national system, so that we say this is the national data for the country. Healthcare planning and resource allocation is very important. How many people came to Shika compared to how many came to Kano, how many went to Ife? That will affect how much resources are being allocated to those places. How many surgeries did we do in Shika? How many were done in FMC Lokoja? How many were done in what have you? This is how you'll be able to say, okay, we want to share resources. Okay, we have bought 40 new theater operating tables. Say, okay, let's just share them to ABU, Ibadan, and Lagos. No. Who does more surgery? They say, FMC Lokoja did 600 last year. And ABU did 100. Okay, let's give to FMC Lokoja. It's fair allocation of resources. Health information management must be involved. The next level is software development. The younger people here should look at it. At the current stage, it is computer scientists and data scientists that sit in their office and design a software, then bring it to you to use. The next stage is for us in health information management to work together with computer scientists, computer engineers, data scientists, and say, look, this software you gave us, there are problems here and there, but we are thinking if we do it this way, it will be better. And that is when you'll be able to develop a software that is acceptable to you, to the system, and will actually work better because you are in the system. So how do we achieve these emerging rules? The first and most important thing in training and retraining. Even people who have finished school and somewhere, I think the professional bodies should encourage them to be engaged in some form of training and retraining on an annual basis. I know most of doctors, nurses, lab scientists have continuing professional development annually and what have you. I think that should be encouraged if they are not existing, because if they are encouraged, you do something, you invite a computer scientist, a data scientist to discuss some issues, and you realize that it opens up your mind. Accreditation and certification of all schools, because now there is a proliferation of schools everywhere you go. Sometimes you'll be wondering, who is actually accrediting these institutions? Who? My brother Taufikia can attest to me. We have seen people who came from schools of medical lab tech come for practical and they can't do anything. You'll be wondering, who gave them that certification? I think that has to be serious. And we should take it along, all of us. I am a member of accreditation team. Most of us are. If we go, if things are not right, please let us state it clearly. It is wrong to accredit schools that are not going to give us. Then upgrading of facilities, yes. These schools can function, yes. We can tell them to do data science, we can tell them to do this, but do they have the computers? Do they have the network? Do they have the software? Do they have the qualified staff? So this is on the side of management and government to make sure that facilities are upgraded from time to time to ensure that these people get the best. There should be improved collaboration with other professionals. Like I said, you cannot put yourself in a corner and say that we are HIM, nobody should come in. That would be very suicidal. You should be able to look at other professions that are allied to you, that are related to you, and you have interaction. People working, computer scientists, Computer Society of Nigeria, you have to work together with them, because the field is not an isolated field. Self-development in data science and computer application. This one goes to all of us as staff, but most importantly as students. I always tell students, this handset you are using is a double-edged sword. The handset, the Android phone. You can use your Android phone for 30 minutes and learn something. Just type into Google, relationship between health information management and data science. You will see a video on YouTube. You look at it, you understand it. If you have questions, you can come to your teachers. 30 minutes. But at the same time, you can use the handset for 2 hours. Facebook, WhatsApp, Instagram, watching nothing. So it is a double-edged sword. It is left to you. Use your handsets for good. Make a commitment that, okay, today, every day, I'll put 10 minutes to check something related to what I do in the school. And you'll be surprised. Go to YouTube. There are a lot of videos, including some of the lectures that you have. You have clarification, practicals. If they are doing anatomy for you, you can go to YouTube and say anatomy of the, let's say they are doing anatomy of the hand for you. You can check. There will be YouTube video for you. Instead of staying for 3-4 hours on Facebook, WhatsApp, Instagram. So self-development is very important. Otherwise, we'll all be stuck the way we are. In conclusion, health information management is a multidisciplinary and evolving field. New development in healthcare in the 21st century has forced us now to move from our traditional comfort zone to the new world. HIM professionals need to work with other health professionals to play a role, their emerging roles. HIM professionals need to educate, orient, and reorient their students to face the expected roles in the future. Before I finish, I would like to send my appreciation to the Chief Medical Director, the CMAC, the coordinator of the school, and Mr. Tawfiq. Thank you for listening.
You can do better, please. Thank you so much, sir, for that wonderful presentation. I feel as if I'm inside the class. Please, around us for our program. Prof has taught, let me use from top to bottom of health information management. Another round of applause for you. During the course of the presentation, we have in our midst our mother, the principal school of post-basic, Ahmadu Bello University Hospital. You are all welcome. I believe we've all learned a lot from that presentation. During the presentation, Prof made mention of one of the reasons why this profession. I was in Polytechnic then, studying civil engineering. So I came back, I met one of my cousins. I saw health information management textbook with her. I was like, what is this? Then she couldn't explain Hassan said is an health information management. So I saw medical terminology textbook. I was like, are you a doctor? I said, no. So that made me to go online. Then I don't have Android phone to go and check what health information management is all about. And one of the statements that impressed me he said, health information management is one of the growing professions in the United States of America. And one of the high-paid professions in the United States of America. So I imagine if it's growing in a developed country, that means it has not started growing in Nigeria. This is a good profession to fetch in. By the time it will start growing, that means I will be an authority. That's one of the reasons why I decided to abandon civil engineering and come for School of Health Information. And thank God today, I'm happy and I'm proud health information manager. If I should continue to mention a lot of things that I penned down during the course of the presentation, we will not go, but we'll leave that for the discussant, because we are going to have discussion now on the topic, on the paper. We're going to ask some questions in order to share more light on some of the points highlighted, because the paper embedded a lot of things. That's the main reason why we decided that we are going to have discussion after the paper. So the next thing on the agenda is to move to the presentation, and permit me to introduce to us our discussants for today. The first person on my paper here is Dr. Umar Farouk, the Assistant Director and HOD Health Information Management Department, AKTH. You are either welcome, sir. Sir, please, you have to come to the activity here, sir. Dr. Umar Farouk is representing the health information management profession. He's going to tell us his own view from the perspective of health information management on the topic, on the paper presented, and some other relevant things we are going to ask based on the themes of this year annual health week. The next person is Comrade Lawal Taufik Babsalam, the JCL chairman of Ahmadu Bello University Teaching Hospital. Is a lab scientist. Is representing lab scientists